Good day. My name is Frank Katita. We're here for Chime and Zscaler's Unlocking the Future of Healthcare Security, Insights from the 2024 Most Wired Security Segment Insights Report. Today we have Tamara Baker, Zscaler's Chief Technology Officer, and Lisa Gallagher, who's Chime's National Advisor for Cybersecurity. My name is Frank Katita. I'm Vice President of Chime Digital Health Insights and DHX, which runs the Digital Health Most Wired and the content group. We'd like to welcome everyone to the webinar today. It's been an exciting time putting together this survey for Digital Health Most Wired. I think it's going to be interesting to see some of the findings that our experts here have drawn out of that. We have Lisa Gallagher, who, as I said, is our national security advisor. She has an extensive background as an electrical engineer. I'll let her introduce herself a little bit more going forward. And Tamara Baker, who has tremendous technology credentials, and I've had the pleasure of working with him many, many times. I think I've seen him more than my wife this past couple of weeks with Vive and some of the other events that we've been doing here with Zscaler, which has been a blast. So I think what we have here is we're going to take a look at the study, and this study comes from the feedback of 342 security and information technology executives from hospitals and health systems through the United States. This year's report provides actionable recommendations. It's just not a report, but it lets you and gives you some kind of guidance of how you might be able to use this within your own enterprise in terms of bettering and bolstering cybersecurity strategy and operations, as well as insights into the actions taken by organizations within the highest levels of digital health performance that have resulted in more mature cyber posture. I think you know that our cybersecurity, our ratings in terms of most wired go from 0 up to 10. So what we're looking at in this report is how people got to be 10, how people avoided going down from 10, and how people that are 8 or 9 are maturing to get up higher in terms of their digital health most wired rating. This is a year out from massive cyber change, healthcare cyber attack, and widespread outages, and the awareness that we need on this to improve cybersecurity is at an all-time high. But there are many questions that remain on where to prioritize remediation and policies within budgetary, staffing, and resource constraints. With the increased vulnerability of medical devices, we have operational technologies and third-party hardware and software. Today's guests will provide a high-level overview of industry trends and the effective processes, as we call them, cyber-forward organizations are leveraging to enhance the value of their cybersecurity investments and improve overall resilience. Today's conversation will be led by Tamara from Zscaler and Lisa Gallagher from Chime. Tamara is a seasoned professional with over 20 years of experience specializing in cybersecurity and technology solutions. As the healthcare CTO at Zscaler, Tamara focuses on assisting healthcare organizations, state and local governments, and educational institutions in their digital transformation efforts. His expertise lies in modernizing infrastructure, optimizing operational costs, and enhancing productivity and security while reducing risk through implementation of zero trust architecture. Lisa, my colleague, has over 35 years of experience and technology leadership experience in cybersecurity in the healthcare sector. Lisa is an electrical engineer by training with experience in system security engineering, security analysis, cybersecurity policy, law and regulation, security engineering process definition, and the development of certifications and accreditation programs. Lisa has twice served as an interim CISO and has coached and mentored aspiring and in-place CISOs. Lisa is also part of co-chair of the HHS ONC Healthcare IT Standards Committee, and we welcome Lisa and Tamara today. Thank you so much. That's a mouthful. So let's level set. From your technical roles and experience, what were some of the biggest takeaways from the report? Any notable shifts in viewpoints or findings? Let's start with Lisa.
Well, thanks, Frank, and thanks for having me today. And I'm happy to be here with you and Tamara. First, I'd like to give a little background on the data analysis we did from the 342 respondents' input. So and this is going to give us some context on how we're going to discuss the results and our insights today. One of the takes on the data that we found was interesting is to take a look at how the better performing organizations in the overall digital most health wired survey, those organizations that were 8 or 10 in the rankings, did versus those who scored 1 through 7. And in terms of our observations in general, we did see that the organizations who in the overall survey were 8 through 10s actually performed better with cybersecurity as well. And the ones that were 1 through 7s didn't perform so well with cybersecurity. So there's definitely a relationship between being more digitally wired and also performing better in cybersecurity. And we're going to take a detailed look at some of those responses and some of those mappings as well. And I also want to note, as Frank briefly mentioned, that for the organizations who performed 8 through 10 in cyber, we call them in the report cyber forward. So they're leaning into cyber practices. And we call the 1 through 7s cyber evolving, in that they have some cyber practices in place. They're doing a lot, but they also have more to do. So cyber forward and cyber evolving. So when it comes to the highest level of the survey results, not surprisingly, cybersecurity is a priority for all organizations that are focused on digital transformation. So nearly 99% of those who responded deemed that cybersecurity was a high or essential priority for both now and in the future. In fact, cybersecurity surpassed other items such as clinical quality and safety at 94%, infrastructure at 88%, analytics and data management, as well as patient engagement, all at 87%. So again, cybersecurity is at 99% of the organizations said most important. So in general, all of these organizations, 1 through 10, see them as cybersecurity as a very high priority. We also understand from the data that smaller organizations and those cyber evolving organizations may not always have an identified cyber leader, someone identified formally. Or in some cases, they have another C-suite executive who is performing that role. But I do feel that it's an important goal to have the identification of a person to lead cyber as a priority. The risks that are, facing organizations today really do point to the need for organizations to make sure that they have identified a cyber leader. And this is an imperative. And we know that there are some options. We know it's hard. We know it's hard to find the right person. It's hard to keep them. It's difficult, but there are some options. For example, if a full-time chief information security officer isn't in your budget per se, we can leverage what we call a fractional executive, which means that you have someone who performs the leadership role part-time. There are also services options where someone you're already working with, a business partner or a consultant, could provide those CISO services as well. So we recognize this as a challenge, but we also recommend highly that it's made an imperative and that we look at alternative means to sort of fill that role.
Good. Yeah, I wholly agree with that. We can't do anything without an actual leader driving the ship, right? Some of the things that I noticed, when we think about the cyber forward versus the cyber evolving, is we wanted to make sure in this report, one of the things that I loved about this report is it does break down, hey, if I am a cyber evolving, what are the cyber forward folks doing that are different? One of the things that I noticed immediately was that 95% of those cyber forwards are implementing that cyber segmentation of medical devices, for example, compared to the cyber evolving, that's only 38%. So this when we look at the report and we see these statistics, it's easy to start spotting the trends of, what others are doing. So if we think about segmentation as an example, the cyber evolving are performing lower than 40%. Fewer than 50% of those organizations implement actual segmentation, right? So I think that number is down to 37%. So when we think about what the cyber forward is doing, they're significantly taking part more in these segmentation projects. If we think about even inventory of these medical devices and mobile devices and all these other employee-owned devices, BYOD, the cyber forward again, those organizations are scored very high that they're maintaining these inventories. They're putting things into place to be able to see and understand what's going on in that environment that is a little bit less controllable than managed workstations. Whereas the cyber evolving organizations are under 60% in this area, and even as low as 25% for the BYOD employee-owned types of devices. So those inventories are important to understand for us. We have to manage that attack surface across the board because they do represent a direct risk to patient safety. So one of the last things I'll talk about just real quick before we move on from this, though, is the cyber evolving organizations are assessing and mitigating threats of risks posed by vendors and products and services, including third-party risk, etc. They're not doing anywhere near as much as the cyber forward organizations. So the 8 to 10 organizations are doing these activities to some degree, but across the board, both the cyber evolving and the cyber forward, so the 1 through 10 across the board, no one's really doing it enough. I think that was one of the lower scoring things that we noticed across the board for all organizations.
Lisa, you spoke about the importance of encryption as a security control to protect the personal information and sensitive data of organizations. Can you talk a little bit about this as a recognized best practice and how organizations are going about implementing that and what some of the challenges might be in doing that? As logical as it might seem, it's not always easy.
So yes, Frank, thank you. The survey showed that 100% of the organizations that are cyber forward, those 8 through 10 organizations, are implementing encryption of both data at rest and data in motion. So that's a good result. But for the cyber evolving organizations, those 1 through 7 organizations, we found that encryption is much less prevalent. So yes, Frank, you mentioned that encryption is considered best practice, and I would add that it is mentioned as a recommended control in many cyber frameworks, and it's also mentioned thoroughly in the HIPAA security rule. So I would go further to say that in the event of a breach, organizations would be challenged at best to justify their lack of use of encryption, and that they weren't complying with best practice, recommended minimum security controls. They may not have been doing the proper security analysis and the risk analysis on PHI containing systems and processes, and determined that encryption was a proper control. And in some cases, it could be deemed negligence. So I would say that organizations that are in that cyber evolving or category that haven't implemented encryption really take a look at this and try to identify where the PHI is and try to make sure that it's encrypted so that you're meeting best practice and avoiding the risk of bad results in a breach and also post-breach regulatory enforcement actions, etc. This is something where we had a surprising result and we have a strong recommendation to follow through and make sure that you're really looking at your implementation of encryption.
Yeah, I want to add one quick thing, Frank, before you move on here. A different spin on encryption that wasn't captured in the report, but I think it's important to talk about for a moment, is decrypting traffic that's leaving your space as well. The reason I bring that up is because when you think about cyber attacks and the bad actors and what they're doing, everything is flowing through encrypted channels now. So if they are stealing data, as an example, when data exfiltration happens, or even if it's a non-malicious insider, right? So an insider's putting PHI somewhere that it shouldn't go, but they're using encrypted channels to do it because they're using, an Amazon server or whatever it may be. if you're not decrypting the data, you're also at risk. So I want to add that even though it's not in the report, strongly recommend that everybody should be decrypting all the traffic that's leaving so that you can catch any sensitive information before it goes to somewhere it's not supposed to go.
Great addition. I just have to ask, we have cyber forward. I'm going to come in from the cyber novice question. Is there anything from the user experience, the typical person in the office, that affects them when there's encryption? Are there usability issues that people? I'm always looking for things that people complain about. Do people notice it?
No, it
No.
it
Okay.
happens behind the scenes. Right? The
Okay.
users
Okay.
don't know that when they're accessing their files and doing stuff. It's not like they have to type in a decryption key to do their work or anything like
Okay.
that.
So it's invisible
Yeah,
in
it's
theory. Okay.
invisible. It's behind the
Great.
scenes.
Yes.
The question is, I mean, we don't have media credentials without talking about Change Healthcare at some point. So I want to bring that up, and we've all been through it. It's not just a healthcare thing anymore. Once change happened, it was affecting people being able to get a paycheck at someplace that was totally unrelated to healthcare, because we have so many endpoints, and then lay on top of that CrowdStrike, which really paralyzed airlines and things like that, although it wasn't specifically healthcare. Tamara, how do you see controlling these many endpoints that people have as this thing starts metastasizing and going into places we never thought it would? What do you say about policing that?
So we're talking about third parties here in particular.
Exactly.
Um, I would say first and foremost, it's not even just third parties anymore. It's third parties, fourth parties, fifth parties. There's so many
Exactly. Right.
because your third parties have third parties as an example. So it's a real challenge. And the report does show some statistics on what people are doing around third parties, a risk assessment as an example. And it becomes overwhelming because the number of third parties that you have, even just third, without going to third, fourth, fifth parties, just the number of third parties makes it nearly impossible to really assess all your third parties,
Mhm.
not just assessing the third parties themselves that are needing access to your environment, but even just the third party software that exists within some of the stuff that you're doing and,
Sure.
and even on your medical devices or whatever it may be. So I think one of the best ways to start, addressing the challenge, of course, do whatever you can for the risk assessment that you've got. If you don't have any kind of risk assessment for third parties, highly recommend you at least engage in that kind of a program, and start building a risk assessment program for third parties. But because we can never really truly control all of the third, fourth, fifth parties that are hitting our environments, I think that one of the best things that we can do actually is to limit the blast radius of something bad coming through from third parties. So if I, and this is a concept of zero trust, right? So I don't really trust you, third party person, to come and join my network. So I don't want you even to connect to my network. Today we're doing, I mean, dozens and dozens of VPN connectivities to all these different third parties, all these systems that need access to your environment, for one reason or another. But the problem and the challenges with these VPN connections is they're pretty much wide open, right? Once I'm on your network, I can start moving laterally as a bad actor. So if I've done something to a third party, I now can move laterally through their environment to get to your environment. So using those kinds of zero trust concepts removes a lot of that risk of third party because now instead of allowing them access to your network, those third parties can only connect and communicate with just the things that they're supposed to talk to. They're blind to everything else in their environment. They can't move laterally. So you're reducing the blast radius. If something bad does happen with a third party, your chances of being completely crippled by it go down dramatically. Now, processes is a different thing, right? So when change went down, like everybody's crippled because nobody can process payments. That's a different thing from a cyber thing.
Hmm.
That's a a chain type of thing. So those type of processes, cyber would have helped in the sense that one of the things outlined in the report actually very early on, one of the findings was those publicly facing network appliances, those publicly exposed VPNs, Citrix, et cetera, those VDI, all these types of appliances that are on the internet are being actively attacked, and actively used for these attacks. So, from a third party's perspective, you know, change could have been a whole different story if those things were kind of hidden and removed from the internet. So, it's another finding that I was surprised by is not really surprised. I've seen the reports that these network appliances are actively attacked and a big threat to the environment. But now it might be something that's more relatable in this report for folks to really understand that these public exposures are also part of your third party risk too, because you're leveraging these internet exposed things also for third parties to come into your environment. So.
Lisa, you've had experience with some of these third parties and your experience as a CISO CIO. What are your thoughts on that?
So yes, I agree with Tamara that third-party risk assessments are very challenging. But I would like to point out that it's even a more fundamental challenge than that. The cybersecurity organization has very little ability to know who all of these third parties are. They don't have input into the contracting of those organizations often. There aren't always provisions in the contract that allow for cyber due diligence so that we exchange information about the cyber practices of those third parties. And often they're not even contracted by a central contracting organization. There are separate business units, business processes that allow for contracting of third parties as well. So the ability of the cyber team to comprehensively manage those in terms of business processes or contractual arrangements is very limited. So we have to go with the assumption that they're out there and we don't always know who they are, and we don't have sort of pre-planned firm contractual relationships with them. So Tamara's solution there is very, very important for folks to understand that we have to control the specific accesses that they have to our IT assets and data. We have to limit them in terms of architecturally and through access controls so that they don't have access to data that they shouldn't have and systems that they shouldn't have. So really this notion of comprehensive risk assessments of third parties is an ideal scenario, but we have to leverage both other procedural and technical controls. And we have to monitor their accesses so that we know where we have further work to do.
Yeah, and one last thing of note is even even when we think about third party software, I don't remember how many years ago, it might have been 4 years ago, maybe 5 years ago, there was a medical device vendor who had third party software inside their systems. And that software was what was attacked by the bad actors. And bad actors were able to log into these medical devices and move laterally and do all sorts of crazy things just because that software existed on the medical device. So when you think about it, not just being people, third-party people and vendors having access, but the software having access as well, it's hard to even see all the software and manage the security of the software within all your devices that exist. However, if you have security in place, you can immediately identify, look, this medical device should not be communicating outside of where it's supposed to talk to. So it's talking to some kind of command and control at this point. That's something that should be blocked and remediated. So even if the software inside the medical device itself is what's being attacked by the bad actor and leveraged, you should still have mitigating controls to ensure that those things are not communicating outside of the way that they're supposed to communicate.
Great answer. So we've talked about and set the stage for some of the bigger challenges identified in the report that are hampering resilience. Now let's talk about solutions. The report showed a substantial gap between cyber forward and cyber evolving organizations on internal security testing, vulnerability scanning, unannounced penetration, a number of different areas. Can you speak to why organizations should be conducting these regularly and the most effective methods to approach the testing process, Lisa?
Yeah, so from the data in the report, we did see a substantial gap between the cyber forward and cyber evolving organizations with regard to the performance of internal testing. So by that, we mean vulnerability scanning, unannounced penetration testing, access control audits, and even phishing testing. In fact, with most of the internal testing areas that we asked about, cyber evolving organizations, those 1 through 7s, conducted these types of tests at rates of less than 50% in all of those categories. So that's very concerning because these are very important analysis tools. We know that they can be hard to implement, but frankly, they are considered fundamental activities of the cyber team. So if you have a cyber function in place, those are actually fundamental practices that need to be in place, that internal testing. They're covered by the NIST cybersecurity framework, other frameworks, other best practices. And so they do represent best practice. And we think they should be a major focus for improvement. I would say one specific word about phishing attacks and an internal, testing of employees, I guess, against their training as far as how they perform against phishing attacks. Not many of the cyber evolving organizations were doing that on a regular basis. Cyber forward,
even the
yeah,
phishing testing.
yeah,
Really?
which was very surprising. So with the cyber forward organizations, even that was at 80%, where others things had been at 100%. So I don't know if that's getting sort of old or they figure they've used it enough. I'm not really sure, but so around 80% for the cyber forward and even much less for the cyber evolving. And I would say we'd expect, the cyber forward to 100% of them to be doing that.
Interesting.
So they can even be improving as well. But I know that Tamara, you have some thoughts on the value of cyber phishing attack, simulated phishing attack testing, and also sort of how that works and manifests when you do it. So
Yeah.
I'll let you respond on that.
So the simulated phishing attacks is great because there are methods later on that we're going to talk about for prioritization of risk that we can determine, hey, if these specific users are constantly failing these phishing attacks, they are a higher risk to your organization, and I may need to prioritize things differently when that specific user's, machines pop up with some kind of a problem, for example. So there's ways to leverage the phishing simulations later to prioritize risk when you see folks that are constantly failing, right? Which every organization has. No, it's nothing to be ashamed of. We all have users that make those mistakes still. The other component that I want to talk about from a cyber perspective when it comes to something like phishing is, again, I mentioned earlier a little bit about, decrypting and understanding everything that's leaving your organization. One of the things that I found across the board when I'm speaking with organizations and we've done testing with implementing some zero trust type stuff, is that we're still seeing phishing attacks being blocked even though an organization has all sorts of anti-phishing things in their portfolio. It's passing right through things like firewalls and other email protections that exist, and we're still blocking it last mile. We're still seeing it last mile right before it gets to that user actually has access to that website. So that's a little concerning to understand and recognize that you may not know even that you may feel comfortable having this false sense of security that I'm blocking phishing anyways. And yet, every single day, I'm constantly seeing the last mile blocks coming through because this stuff is encrypted. It's going to real Amazon web servers being hosted, right? So they look and feel they're being hosted on a Microsoft server, right? So the trying to block by traditional means has become exceedingly difficult. And that's one of the things that I would like to make sure people are considering is that false sense of security. There is more blocking to be done. That last mile should be looked at as well.
Thank you. You used the word prioritization a number of different angles here. We know that part of this is because of a lack of visibility into device inventories and communications. Can you talk a little bit about that prioritization of remediation aspect and making an effective use of inventories to more effectively close vulnerabilities?
Yeah, so we spoke earlier about the high level of those cyber forward 8 to 10s. They've got a great inventory. They're doing more vulnerability management, etc. The challenge really becomes with two things. One is prioritization, and two is workflows. I'll talk about both for a second. One, when you think about vulnerability management, inventory, it's great to have all that data, but it's overwhelming. Here's all your inventory of things, and here's the thousands and thousands of vulnerability that exist across your environment. It's a really hard thing to prioritize, and that's, a tough part of the cyber teams to do. Job is how do I prioritize all of this stuff, right? What do I pay attention to first and foremost? There are ways that exist that we can leverage specific technologies to show you, okay, just because a vulnerability on this piece of device is a CVSS score of 10, highly critical vulnerability, that doesn't mean it's a number one priority. We have to also understand, is it on the known exploited vulnerability database, right? Is it being actively exploited? What are the chances? There's an EPSS score that shows you the likelihood of this vulnerability being exploited. Is this something that's internet facing or is it hiding from the internet? Because if I have a critical vulnerability that's actively exploited in the wild, but the attack vector is closed and I can't even reach that device to exploit that vulnerability, the risk prioritization should lower for me and my teams, and I should focus on things that show me what is internet exposed, which devices have users that are failing phishing attempts and they're missing their EDR agent. Those are a little bit higher of a priority, right? So there is ways to collect this data using technologies because the spreadsheets and the human version of trying to do this these days is very, very hard to do this prioritization on your own. You can use technology to show you all the different prioritizations and then implement the workflow automation pieces too, meaning the second challenge with this is now I've got a stack of prioritized vulnerabilities and I throw it over to the other teams and say, okay, go fix it. Well, the challenge also becomes, okay, I have fixed this, but you're still showing it's not fixed, or the back and forth on making sure that what's fixed it should be fixed or not. So there's a workflow automation piece that needs to come into play where these things, these prioritized vulnerabilities, these prioritized actions that need to happen flow to the right owners of those systems. And then once they've done the work, it should automatically report back so that the security team knows the job is done and they can move on with the next levels of prioritization. So I think there's a lot that goes into it. It is one of the big challenges that exists, even for those cyber forward organizations where they may have a good vulnerability scanning in place and they're doing asset inventory, but all that data is too much for any of us to handle, especially with the manual means. So highly recommend we go more of the automated means and prioritization efforts get put into place there.
Lucy, you're shaking your head.
Yes, I totally agree with the automation aspect. I think it's very helpful.
So, Lisa, the report also showed that cyber evolving organizations are struggling with DLP, 40% of them, network segmentation, 37%, database monitoring, 38%, and GRC, 35%. Can we talk about the importance of database monitoring and the role of governance in ensuring critical security processes and tools are being used effectively? I mean, again, I think we all know that along with what happened to change and what's happened with cybersecurity in general, that governance has become sort of cool again. It used to be the day that you wanted to call in sick, and now between
Right.
AI and cybersecurity governance, people say I can't get enough of this because it's a really interesting place to be. So, talk to us a little bit about governance and what you're seeing in those cyber evolving companies.
Right. So you mentioned a number of statistics, and I'm going to go through a couple of areas. So first of all, on database monitoring, which is simply monitoring all accesses to databases. I mean, that's a basic and critical cybersecurity control. I mean, after all, these databases have our PHI, right? And so when we look at a response rate of 38% for the cyber evolving organizations, that's just quite frankly very concerning. So I have to say, all of these organizations must evaluate how they can implement this basic practice right away. You should be monitoring all of your databases that you know about that have PHI on them. I want to talk a bit next about network segmentation. because it's surprising to me, and I know Tamara talked about it earlier, it's surprising to me that we have a 37% rate here with cyber evolving organizations. This has always been an interesting topic to me, network segmentation, because it is one opportunity where we have the ability to do what I call proactive architectural design for resilience, right? A lot of what we do with our cyber controls choices right now involve hardening on the perimeter and endpoints, and then sort of monitoring to see if someone got in, like if a threat actor is in our network. But with network segmentation, we can make the assumption that we know they can get in sometimes. And if they're going to get in, what are the proactive things that we can do to make sure we make it harder for them to move around laterally and get to our more valuable assets? So we isolate them on the network. We do that proactively. And so in a sense, we're architecting in resilience to attacks. So why would we not want to do that? I mean, I think it's sort of an additional or maybe a third dimension to our set of controls, which are hardening the perimeter and then detecting when someone's in. Okay, well, when they're in, let's proactively architect in some resilience. So I would encourage organizations to look at network segmentation. That might require the cyber people to work with the IT architect and to do some things that might be hard in a complex IT environment like healthcare. But again, it is a proactive security control. So that's kind of my advice on that. And finally, Frank, you asked about governance. And a lot of people say that's a buzzword, or what does it mean? Well, it's really about what is the best way to manage cyber risk. And a lot of times we tend to do that very informally. We run around and we hear about vulnerabilities and we run around trying to get everybody to mitigate them. And a lot of times things fall through the cracks. It simply means adding some formality to the way that we manage cyber risk. And that's always an important thing to do. Now, a lot of people will say that that's expensive, time consuming, and challenging for maybe the cyber evolving or the small organizations. But there are some simple things that we can do. We often have collaboration between the cyber team and the IT team to mitigate vulnerabilities. Maybe we add a little bit of formality to that, in that we're organized in how we approach that. And we have policies in place that allow us to have some accountability when vulnerabilities aren't mitigated, right? So we're eliminating tacitly accepted risk. But it doesn't mean we have to have a full-blown program in place. We can do some small things like adding a little bit of formality, and tracking mitigations to closure and identifying when they're not closed, and adding some sunlight and accountability to that. So governance can be a confusing word. It can be a word where people think it's hard to implement, but really let's look at some simple solutions that we can bring to bear in the form of risk governance. So I would highly encourage organizations to think about this, especially the cyber evolving ones, to find that some simple changes can really bring some sunlight into our ability to actively manage risk and make risk-based decisions.
I think if I may add a few
Please.
on a few of those topics, when you think about the data protection side of the house, it's clearly evident that across the board, 1 through 10, actually, data protection is a four-letter word. It hasn't been implemented in most organizations. When we talk about data protection, it's always I don't have the people to do it. It's too cumbersome, too challenging. There's too much work to be done for something like that, which is surprising because especially with the new HIPAA regulations coming out and everything, like this is critical that we have to get our heads around this. I will say there are technologies that exist to make it easier and simplified. If you're able to see exactly where all your data is, where it's moving to and from, which users are touching all that data, and all that information is presented to you with some simple policies to say, hey, do you want this to happen or not? Like there are ways to overcome this where you can have full-blown data protection programs with a single type of ad, maybe not even an FTE, part-time FTE working
Mhm.
on it. So there are ways to use technologies to your advantage to make data protection easier, more digestible, something that you actually can stand up. From the network segmentation conversation that you had there, Lisa, there's a couple things I'd like to add. I think when we think of segmentation, there's a few different ways to think about segmentation. One is, the medical devices, right? So device type segmentation. When you're on the network, devices are always going to be there, on the network doing what they need to do. So we have to have segmentation in place to try and make sure that those things don't talk outside their bounds, as well as other things don't have access to them, right? So that's one component of it. And I think that the traditional means of trying to do segmentation has been a challenge, trying to use things like ACLs and 802.1x and VLANs, et cetera, has been challenging for, I'd say, the vast majority of organizations, but especially the cyber evolving ones. There are ways to do segmentation with human readable technologies too that makes it simpler to say, hey, these types of things should only talk to these types of things without having to come up with IPs and ACLs and all these other rules. But there's a different kind of segmentation that I also want to talk about. And this is, you mentioned it many times. You have a perimeter, you're assuming that somebody gets in and ha is eventually going to get into that perimeter. Those are exact zero trust terminologies, right? That we don't have a perimeter anymore. Nothing can really be trusted just because it's on your network. We can't really trust that it's supposed to be there doing what it's supposed to do. So what I usually like to talk about here in this case is we shouldn't be even connecting users to the network. We should only connect users to those applications they need access to. They should be blind to everything else on the network. They shouldn't even know and be able to do a scan and see what's on the network at all. They should just be blind to it all. That's a different kind of segmentation that I think is more of that zero trust approach that we talk about when you hear zero trust and you want to try and understand and wrap your head around zero trust. There's no more perimeter. Like we don't want to trust. Like if a user's on the network, they shouldn't even be able to see anything, right? They should just be able to only see what they're supposed to have access to. So those are just a couple things I wanted to tag on to and round off from a technological perspective. When we suggest, yes, these things should be implemented, we highly recommend it. You need to have data protection. You need these things there, especially the cyber evolving organizations that may not have the human capital to do big giant
Mhm.
projects, especially the smaller rural folks that are on the call or on the webinar listening. There are ways to leverage technology to your advantage, where you can do this more operationally efficiently. You can do this with less human capital. You can do this with less point products. So there are ways to overcome these challenges, even when you don't think you have the resources or means to do it. Because I've seen it already, where we go into a shop that's got four people in IT, and one person is both your network engineer and your cybersecurity engineer, right? Like it's very common, but there you can leverage technologies to your advantage to help you accomplish these goals that we talk about in a meaningful way.
I'm so glad you brought up rural because I mean it's again it's not a buzzword, it's a reality, and it's they're the underserved. So I'm glad you brought it up, and I'm just sort of curious, how are there any innovative ways you see people with limited staff, like you said, it's a man, what the Brits would call a man and his dog in the IT department. How do you see they're doing that, Tamer?
Yeah, I mean, it really boils down to I talk about technology, but more specific than technology, leveraging as a service technologies, because when you take the burden of managing boxes and managing stuff and constantly having to manage all that stuff, that adds all that extra time to your plate. If
Hmm.
you shove that to somebody else to manage it, and all you have to do is think about the policies I want to write and accept, it makes things a lot easier. That when I think about technology, and I mentioned technology several times, it's about removing the manageability of it and offloading that management to somebody else to take care of the hard work, and you can focus more on the things that are meaningful for your organization.
Great answer. Uh, we're running out of time, but we have a couple questions from the studio audience that I'd like to propose. How can health systems like ours use AI, we've got to use AI to get our credentials as well, to improve security without major budget or infrastructure overhauls.
We almost got through a whole webinar without AI. Unfortunately, I
Impossible.
had to come up with the
Impossible. Impossible. They'll
end.
take us off the air.
Yeah, that's true. Yeah, I'll kick this off, Lisa, if you don't mind. Like, so from a cyber perspective, there are lots of ways that you can implement AI. Again, especially if you're using this as a service type technologies that we talked about. When I brought up the scenario of data protection, AI can be involved to show you again, here's how everything's currently happening with your data, no matter where your data lives, no matter where it's moving, and no matter where the users are and where they're accessing to and from and how they're moving the data. AI is part of that process to show you simplification, right? So you can have an easier data protection program to say, again, these are the easy rules that I can implement for data protection leveraging AI. AI can also be used for what I talked about before, which was the prioritization of risk. There's so much data that exists from the endpoints and the inventories and the vulnerabilities and all the blah 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 blah, all these different things. AI is there to help and ensure that you can use AI to help you with this prioritization. You can help you use AI to really understand what risk looks like because it can see so much more than any humans
Mhm.
can. So, I mean, those are just two simple things that AI can be leveraged to show you here's all the applications that exist in your environment. Here's all your users that are accessing as applications. Let me suggest from an AI perspective like, hey, these are some suggestions to get this segmentation thing a little bit easier for you, right? Because it's too much to manage for a single person to understand out of my 500 or 1,000 applications. Even the smaller rural locations have hundreds and hundreds of applications. Let AI help you understand what's going on, how things are moving or communicating, and suggest some really good segmentation rules for you. So, just a couple of examples. There's other AI use cases too that exist where I want to enable my users to leverage AI in my environment. I want to empower my HR, clinical, all these different team members to use AI as well. But from a GRC perspective, Lisa, there's got to be some governance wrapped around how I enable AI in my environment, and make sure that PHI doesn't go into these publicly facing bot, chat GPTs, for example. So there you can also leverage technologies to ensure you see all the different prompts being used and all the different AI tools that exist that are right under your nose that you don't even know your users are using and make sure that you're stopping PHI from going through that. So there's a few different things when it comes to AI that we can cover
Yeah, that
there.
goes back to my point that cyber and AI are co-joined in terms of governance when they come together there. Lisa?
Right. And I think those governance rules, those sort of principles that we need to apply in the use of AI are still being developed. We're still trying to both understand the capabilities that can help us and then, have some guardrails on how do we use it intelligently. So those conversations are going on at the same time. However, we already see some advantages in using this, as Tamara mentioned. So definitely an area that we're all working on, in making sure we understand how we implement it, but also what are those principles and guide rails that we need to use.
We have one last question from our studio audience here before we conclude. Zero trust is often recommended, but where do we start if we're balancing legacy systems and tight budgets?
Yeah.
Tamara?
Obviously, I think that was directed to me.
That's a good
So
question.
yes. So I recently wrote a book on the Zero Trust Hospital for CXOs. One of the things that we talk about is this myth in one of the chapters about zero trust being too cumbersome, it's too hard, it's too burdensome. Like, how do I even start, right? There's just it's a 5-year project. When it really isn't. We've got a great example of one health system, large health system, 50,000 users, so they weren't insignificant. Where it was able to roll this out, a zero trust solution and architecture in 3 weeks for that large of an organization, and they leveraged one intern to do it. An intern, so not even a full-blown
Wow.
engineer. So that it's a great testament to show that, it doesn't have to be this cumbersome thing. Some of the easy button wins on this really is when we talk about the vulnerabilities, especially at the very beginning of the report. People are going to find out about the exposed network devices as an example. An easy step one on zero trust is just hide everything from the internet. I mean, you can do that very simply, very quickly, very easily, even if you're not enacting all the different segmentation rules and all the different, who has access to what, and that all comes later. But just easy step one is just take it all off the internet, hide it behind a managed security cloud so that you don't have to take care of the security of it. It's completely hidden for the bad actors. That is a very fast win, very, very quick way to reduce a lot of risk, and start that zero trust journey. It's just removing it from the internet, even if I haven't carved out who's allowed to talk to what yet. I think that's the second thing I would say too, from that perspective is, once everything's off the internet, you still want to quickly and easily turn on that decryption and monitoring so that if something bad isn't, going on in your environment, all that's being stopped and blocked before anything gets really far along. So just the simple quick wins, if that helps. If it doesn't, I mean, I'll throw a plug in here. Read the book. You can always ask me. I can give you a copy of the book. We do have an architect's guide to that book as well. That is more of the recipe of how to implement versus the CXO vision of understanding how zero trust really can help lower costs operationally, give your clinicians a better experience, et cetera. So.
Well, and I think, to the participants' question, I mean, Tamara just gave two really good examples of what you can do with limited resources. And I think that was major part of the question, right? And that's the point. There are things that you can implement that are fairly low resource utilization that will get you along the path towards, architecting zero trust.
Yeah.
Fantastic. Well, I'd like to thank you both for an insightful afternoon on the Digital Health Most Wired privacy sector, cybersecurity sector trends report and segment report. To that point, you'll be able to get the segment report shortly after this webinar by clicking on the QR code that we'll have up. We'd like to thank the audience for joining us, and this is a continuous flow of information that we have coming from Digital Health Most Wired. It's not just one survey and one event. We're going to be doing this throughout the year. We're also gearing up for our 2025 cybersecurity survey, which will be, just by the nature of the market, will be dramatically different than we've seen in previous years because things are moving at that time in that speed of time with both AI and cybersecurity. So we'd like to thank you for that, and please join us again. And on behalf of Zscaler and Chime Digital Health Most Wired, we thank you for joining us today.
Yeah, thanks for having me.
Thank you for having me.